Hi, everyone. I'm Maggie McGrath, senior editor at Forbes. Over the weekend, Congresswoman Sheila Jackson Lee announced that she has been diagnosed with pancreatic cancer. The news is trending today, and so we wanted to sit down with an oncologist who can explain more about the disease. Joining us now is Dr. Sanjay Reddy, a surgical oncologist with Fox Chase Cancer Center in Philadelphia. He is also the co-director of Fox Chase's Pancreatic Cancer Institute. Dr. Reddy, thank you so much for joining us.
Thank you, Maggie.
Representative Lee is the latest in a string of high-profile leaders to receive this diagnosis. Within the past few years, we have seen cases with Justice Ruth Bader Ginsburg, Congressman John Lewis, Apple co-founder Tim Cook. And so I want to start by asking, how common is pancreatic cancer in the United States?
So pancreatic cancer is becoming more common, mostly because of people coming out and talking about their diagnosis, right? We are much more proactive than in years past instead of being reactive. And I think that by being proactive, we're looking for signs, we're looking for symptoms, we're trying to engage the disease process at an earlier time point in time. And you'll see sort of time and time again that if we can catch it at an earlier stage, it usually portends a better prognosis.
Now, Representative Lee, as far as I have seen, has not indicated what stage of cancer she has. Is that correct? What do you know about her case?
That's correct. So from what I understand, no stage has been assigned, but she has begun treatment. Now, it's interesting because treatment generally starts with chemotherapy. Whether pancreatic cancer tumors are either, I always say it in my clinic, within the box or out of the box, generally speaking, in a lot of cases, it starts with systemic chemotherapy. And the reason is that this disease is really a systemic disease at the onset of diagnosis. So it's really imperative that treatment be started as soon as possible. The difference, though, between the in the box and the out of the box scenario is that if it is metastatic disease, it is technically incurable disease, and the chemotherapy is a way to keep the disease at bay as best we can. But for the other group of patients that have potentially resectable or removable disease, systemic chemotherapy is an adjunct, meaning that after that, depending on how they do, the ultimate goal is to make a patient to the operating room for surgery.
So just to break that down a little more, in the box means it has not metastasized, and out of the box means that the disease is prevalent in the body and therefore lifetime chance of remission is very low.
That's correct. That's correct. And we know that if we can tackle the disease at an earlier time point, we have better chances for survival.
Why is it that this disease is so out of the box in typical cases? I feel like most of the headlines we see or talking to friends and family, this is usually diagnosed, again, anecdotally, in the later stages. Do we have an explanation for that?
Yeah, that's a good question. I think there's not a great explanation. I think the real sort of problem is that it's so insidious, this process, right? So the symptoms may not be as wide, if you have a colon cancer, you have rectal bleeding. In pancreas, by the time you become jaundiced, if the tumor is causing a blockage of your bile duct, a lot of the time the disease has already sort of laid its roots in the ground, and those little seedlings are already there sort of germinating. I think that's the problem with this disease in particular, is that it's just an aggressive disease. But this is also where we've become much better about being more attentive to symptoms, right? So new onset diabetes, weight loss, nausea, vomiting, the other typical things that we see. But this disease is one that is just an insidious process that just sort of lurks and under the radar until it becomes more obvious.
So just to highlight those symptoms you said there, weight loss, nausea, vomiting, those can be relatively common symptoms for myriad diseases.
That's
So
right.
what should someone know about their own bodies and when to call a doctor and what to do?
Yeah, I mean, I think, first of all, prevention is the best medicine, right? And I think going to your primary care, getting your routine blood work, subtle signs and symptoms, for example, again, new onset diabetes in an older patient is something that should be a trigger, an alarm. If you have now, chalky stools, maybe you're having some pancreatic insufficiency where your pancreas is just not working on all 8 cylinders, that could also be a time point that you may want to intervene. So again, it's good primary care physicians that really sort of intervene at an earlier time point that hopefully identify these patients earlier.
You said nuance at diabetes. I am not a physician. Can you break down what that means?
Yeah, so if a patient now all of a sudden has increasing problems controlling their blood sugars, that should alarm something as to sort of, why is that? Is there some dysfunction going on in the pancreas due to a mass or due to some other process? And I think those are, again, some things that we can identify. The pancreas has sort of two functions, right? There's the endocrine function, which regulates your diabetes, and then there's the exocrine function, which helps with your digestion. So if one of those is off, it could be a trigger that something more is going on.
What are the treatment options for pancreatic cancer in 2024? You alluded to chemotherapy and then decisions that can be made after a cycle or several of chemo. But we sit here in 2024 when there have been so many medical innovations across not just cancer, but heart disease and diabetes and so much more. Have the treatment options improved for patients?
Yeah, I would say yes. I mean, if you look at the 5-year survival rate, every year we are upticking in the percentage. I mean, right now, the 5-year survival rate for pancreatic cancer across the board is 13%. But when I started my practice now 12 years ago, I think it was 7%. So we've seen sort of these increases over time with the disease. But the advances we're making is really multifactorial in the sense that it's a team approach, right? We really, lean on each other as a multidisciplinary team with medical oncologists, radiation oncologists, surgeons, our GI doctors, and really our scientists, right? Because they're the ones that are also making some groundbreaking discoveries with this disease. And we've learned that it's the combination of therapies, chemotherapy, radiation at times, and surgery seem to be that secret sauce to get sort of everything kind of working again. But I think that is the advances that I see, is that we're working more collaboratively than ever to treat patients with this disease.
Now, when I named the high-profile people who have been public with diagnoses or have succumbed to the disease, I named men and women. But is there a gender breakdown in patients in who is more likely to get diagnosed with pancreatic cancer?
In general, I see a pretty even split, just anecdotally, just in practice. But again, I think one of the biggest things now is a family history, right? That seems to be another way that you sort of become more proactive and not reactive, right? If you have a family history of pancreatic cancer, then perhaps you need to, pay extra mind and extra attention to those sorts of things. Genetic testing is offered for high-risk individuals at times as well. Now, every pancreatic cancer patient we see, they get genetic testing for the reasons of some of the times there could be mutations that are causing this cancer diagnosis. So for example, if you have breast cancer and you test positive for the BRCA mutation, that's another trigger that we use in pancreatic cancer to see if certain therapies work better than others.
And what about age breakdown? Representative Lee is 74, but Tim Cook was roughly 49 when he announced his diagnosis. Is this an equal opportunity cancer when it comes to age?
Yeah, I mean, the number you quoted was pretty spot on in terms of the average. But we see patients in their 30s. And it's really across the spectrum. Age is not necessarily a rate defining denominator here. I think every patient is an individual. When it's genetic predisposed to cancer, especially when you see a young patient, the first thing you think about is, oh my God, did you have a family history? Is this why this developed here? And at times that is the cause, but I think age, we're seeing a wider array of ages, and I think it's partly because, again, we are much more proactive about trying to identify the process of the disease.
I'm glad you mentioned the wider array of ages, because we are speaking at a moment when the average age for the first recommended mammogram has been lowered to 40 years old from 50 years old. And also we've seen the recommended average age for first colonoscopy, that's been brought down to 45. What is going on here with cancer rates among young people? Should we be worried, or is it, as you say, a cause of increased awareness?
Yeah, I mean, that's a really tough question. And again, I'm sure there's multiple layers to that answer, but I do think in part we are doing a better job of being more aware of our symptoms in our bodies, right? And again, I think I can't say this enough, but preventative care is the best care, and being proactive about seeing your primary care and reaching out to physicians that could potentially intervene sooner rather than later, I think is really important in the cancer world.
Preventative care is the best care. Obviously, seeing your general practitioner, going for your well visits, but is there anything else people should be doing when it comes to eating, sleeping, exercising? Obviously, they should be doing all of the above, but anything specific?
Yeah, I mean, I think anything in life, anything well balanced, right? I think a combination of healthy eating habits, exercise, those are things that seem trivial and just sort of ordinary, but I do think that makes a big difference, both in, again, being healthy in general, but trying to decrease some of those risk factors.
Well, we've talked about symptoms, causes, prevention. Dr. Reddy, is there anything else we need to know about this disease today as it trends because of the news from Representative Lee?
Yeah, and I think, the biggest thing I can say is every patient starts at the same starting line. And it should be a situation where efforts put forth in whatever way that we can. And, can we get people through treatment into surgery following chemo? Yes, we can. But if we can't, is that a failure? No, absolutely not, because there's treatment options available. And if the best we can do is sort of control the process and keep it at bay, we can do that. But I think a true team is really sort of one of the most important factors for the patient in their journey. And I can't stress that enough. It's not just an individual treating the patient, it's really a team.
Dr. Reddy, thank you so much for your time today. We really appreciate it.
Thank you.